As announced this morning, we've opened up booster doses to anyone 18 years of age or older who had their second dose at least 5 months ago. Now, let me be clear. Getting a booster dose is the single most important thing that you can do. So if it's been at least 5 months since your last dose, book your booster right now. While we were originally aiming for the 6-month interval to provide longer-term protection, we are making the strategic decision to move up these doses to protect Albertans urgently, given the rapid spread of Omicron.
Now, unfortunately, Omicron has made it necessary for us to make a few more changes to reduce contacts and slow the spread of the virus. Businesses participating in the Restrictions Exemption Program have done an excellent job of following the rules and allowing vaccinated Albertans to continue accessing their services. However, due to the risk of breakthrough infections, we need to make some adjustments. Venues above 1,000-person capacity are now limited to 50% of this capacity. Venues with a capacity of between 500 and 1,000 are capped at 500. Consuming food and drinks is not permitted in seated audience situations in large venues or during intermission, to ensure masks are continuing to be worn throughout. With the increased transmission risk of Omicron, it's important that the overall numbers of people mixing in venues be limited and that attendees remain masked at all times. As the Premier said, we need to avoid super spreader events. This change will apply, for example, to NHL games, as well as the World Junior Tournament set to begin on Boxing Day. Restaurant and bars participating in the REP are limited to 10 people per table, and no recreational activities such as dancing or billiards will be permitted. These changes will take effect at 12:01 a.m. Friday, December the 24th. We will also be requiring all businesses participating in the Restrictions Exemption Program to cease alcohol service at 11 p.m. and close by 12:30 a.m.
I don't have specific data on the number of cases that have ended up needing hospital care. What I would reiterate, though, is that it is very early to be able to determine the severity. We know that typically rises in cases take a couple of weeks before we see a rise in hospitalizations. And even though the Omicron variant is spreading so rapidly, the rapid rise in cases, again, we wouldn't expect to see the impact on acute care immediately. That would take several weeks. The other thing that we know from watching our Delta wave is that when we saw a steep rise in cases, it actually took about a month before we saw a significant and steep rise in ICU admissions, partly because the initial rise in cases was predominantly in those who were younger, who by their age had a lower risk of severe outcomes. So it could take several weeks before we see any impact or significant impact in acute care, and we should not mistake that for reassurance that Omicron is definitely mild. Again, we must take action now, and it's really important that we take this seriously.
Well, we are doing what we think is necessary based on the information that we have right now, but we are always ready to take more action should it be necessary to protect the healthcare system. I think in the next 1 to 2 weeks, we are going to start to see, I think, important data emerging from jurisdictions like South Africa, Denmark, the United Kingdom, and some others, which are ahead of us on the Omicron curve, and we'll be able to draw clearer inferences about what this variant represents in terms of severe outcomes and hospitalizations. Right now, we continue to be in a position of uncertainty. That's why we are proceeding with caution, and we ask all Albertans to do the same.